Thanks. It's so great to be here with this great group and just really looking forward to having a conversation about this work. As you'll see, this is joint work with many great colleagues, some of whom are in the room, and I'll acknowledge them along the way. And I'll be talking about the new lessons from the Kenya General Equilibrium study. So the background is an interest of ours and a scholarly interest, a policy interest in cash transfers. They've become really ubiquitous across countries in recent years, both as just a straight up poverty alleviation tool, but also as a social protection instrument. Scores and scores of countries have implemented them. So there's a lot of interest in understanding how they work. When we started this project back in 2014, our goal was to really try to advance a broader understanding of the impacts of cash transfers, and in particular, unconditional cash transfers. The early work had really focused on studying the effects on the direct recipients of cash, kind of immediate effects or short-run effects of cash, and we wanted to go beyond that with this study. So we were motivated by several open questions at the time, or leading questions. Again, the kind of fundamental goal of the study was to understand broader impacts beyond direct recipients. There was a lot of concern at the time that the study started about a decade ago in the possibility of adverse effects for non-recipients. Could it be the case that when there's a big infusion of cash in the economy, there's a surge of inflation, and there's actually negative consequences for non-recipients? That was something that was on a lot of people's minds. But there's also the possibility that there could be positive effects, positive spillovers through various channels that we were interested in studying. We wanted to measure those. We wanted to understand how they aggregated up in the local economy, and through what mechanisms. How did that work? Another fundamental question was heterogeneity. So again, going beyond sort of average treatment effects for recipients to understand who benefits more or less from cash transfers. Here, as I'll talk about, we had a design with a quite large sample, and that was on purpose. It allows us to get at heterogeneity. We're just better powered to get at heterogeneity. So that was an important part of the design of the study. And then this is an interest of several of us on the team, and certainly a personal interest of mine in carrying out long-run studies. Sometimes short and long-run effects differ. It's difficult to track samples over time and put in place the data collection to do this, but on some level in development, this is kind of what we want to do and look at longer-term impacts of our interventions. So we wanted to know if there were intergenerational effects. What happens to the children of recipients? What happens to their survival? What happens to their human capital? And then more broadly, what happens to local economies in the long run if there are cash infusions in the local economy? So these were the kind of motivating questions, and there are really a range of different topics you can imagine. Focusing on, in the long run, is there in-migration into areas where there's cash? In the long run, are there effects on, longevity or, healthy aging? So that's something that I've been interested in lately, and so on. Okay, so I'm going to go through several different papers. I think the first three have been presented in NBER and BRED meetings, and people have seen, versions of them. The fourth one, my co-author Michael Walker is presenting in the children's group here on Friday, and I'll give a little more detail on the fourth paper because there's more kind of new results there. So I'm going to kind of go through these papers, summarize results, but also talk about how they fit together, and then synthesize some lessons at the end of the talk. I'm also going to talk about some pretty interesting new policy impacts of this research and this research program on the Kenya General Equilibrium study. And really knowing about this program is thanks to Kate Orkin, whose paper was presented yesterday by Paul and Rob, that great presentation yesterday, which is related to today, and a couple other policy implications. Okay, so just background on this study. We started the project in 2014. We were really fortunate to be working closely with Give Directly, this very large provider of unconditional cash transfers, and really fortunate to be able to fundraise for extensive data collection. So that's kind of like the foundation of the project. We were able to carry out an RCT in Siaya County, Kenya, in a sample of 653 villages with 300,000 people. So, quite a large scale project, and that's going to be important for understanding aggregate effects, for being powered to understand heterogeneity, et cetera. And I want to emphasize four things that I think are important that really, are going to come up again and again as I talk about these four papers. The first one, and kind of fundamentally the most important one, I think, in terms of the design, was the fact that we had a two-level randomization of treatment with unconditional cash transfers. Most studies would randomize at the household level or maybe a village level. There was randomization at the village level in this study, but there was also randomization of the saturation of cash transfers at the sublocation level, which is a collection of about a dozen villages. So there were high saturation sublocations, low saturation sublocations. In the high ones, 2/3 of villages were treated. In the low ones, 1/3 were treated. So there's this exogenous variation in how much cash is going into local areas that we're able to exploit. So that's really, central to being able to study the spillover effects in several of these papers. The second point I want to emphasize, again, is extensive data collection. We put a lot of emphasis in measurement. We wanted to be able to construct a local GDP measure. That is not a trivial thing to do. And to do that, we had to carry out censuses of all households in this area, again, 65,000 households, censuses of all enterprises in this area. And then in representative subsamples of households and enterprises, we did our usual really detailed surveys. So with appropriate reweighting, we can get at aggregates. Here, we're also interested in understanding real effects, not just nominal effects. So we put in place market price surveys across scores of markets every month, across 70 different products with multiple prices per product. So it was a large-scale effort. There's no equivalent price data that the government is collecting in rural Western Kenya. So we had to do this ourselves. Here, on the health side, and I'll talk about the child health results as well, we were interested in measuring child health outcomes and child survival, but also cause of death. So we carried out verbal autopsy data. There's no vital statistics data in this part of rural Kenya. We had to do kind of the best alternative, which is a series of questions to understand the cause of death. So there's a lot of work that went into understanding this. Like, I hadn't done verbal autopsy data. We had to work with the Kenya Medical Research Institute, which they trained our team, and we were able to incorporate this data. As a result of these investments in data collection, and again, just being fortunate to raise the funds from different sources, and I'll acknowledge them later, to have a large team, we've been able to maintain over 10 years. We actually just finished the 10-year follow-up a few weeks ago, over 90% tracking rates, balanced across treatment groups. So again, it gives us some confidence that we have a pretty representative take on what's going on in this local area. We also follow moving households if they move out of the area. So not only do we have kind of snapshots of GDP within the parts of Siaya County that we're working in, we can go back to the baseline household sample and follow them up. So again, it's a heavy lift. It's not super glamorous to have the multiple calls every week where we're figuring out how every enumerator is doing and whatnot, but that's what you need to do to collect this kind of data. We also registered pre-analysis plans along the way. We were starting just as pre-analysis plans were becoming more common for the various pieces of analysis, and not just the kind of straight up treatment effects, but the other parts of the analysis too, including one of the papers I'll talk about is really a kind of applied macro theory paper to try to understand the source of multipliers. We registered some of the more structural macro analysis in a pre-analysis plan there too. So we're trying to kind of advance the use of pre-specification in economics. All right, so that's a mouthful, but those are some of the key elements, and they come into play in various pieces of the work. Okay, so again, the project was enabled because we had a partnership with Give Directly. Give Directly at the time had a model where they distributed cash transfers using a very simple proxy means test. They basically found households that had a grass thatch roof, which were kind of poor households on average, and they got a very large transfer, $1,000 nominal transfer, which was closer to $2,000 in PPP terms, and in today's dollars with some inflation, over $2,000. This was a very large shock. It was something like 3/4 of annual household per capita income for these poor households, so like a really meaningful shock. It was a meaningful local GDP shock of something like 16% of local GDP in the year when most cash went in, and it was distributed via mobile money in 3 tranches over 8 to 10 months. So it's a one-time transfer, and they never went back and gave additional transfers in these villages. It was one time, but kind of in these 3 tranches over 8 to 10 months. So just something to keep in mind, especially for some of the results later on. This is what a grass thatch roof looked like in this part of Western Kenya. A little bit more data here. This simple targeting criteria on grass thatch roofs actually did identify in our data somewhat poor households. So the eligible households with the grass thatch roofs have about half the measured wealth as the ineligible households that had a metal roof. So actually, they did a pretty good job of finding poor households. The differences in consumption are more muted. If you look at earnings or consumption, instead of a doubling, maybe there's a 10 or 20% difference depending on how you measure it. So, that isn't quite as clear, but at least the slope is in the right direction. Like they are poor in terms of consumption. They're much poorer in terms of wealth, the eligible households. That said, if you plot the distribution of consumption or income for these groups, there's a lot of overlap too. This is the map of Kenya. You can see Siaya County in the west in green. There's about 100 households per village. And again, back to Paul and Rob's talk, with Kate yesterday, it was great seeing their talk. There's a lot of commonality because they're working in an area just south of our area. And actually, a lot of the headline results are quite similar between the two studies, which I think gives more confidence that two very similar studies were done in nearby areas. We're getting a lot of similar results, but the demographics are similar too. There's about 100 households per village, 4 to 5 household members. Everybody's working in agriculture because towns were excluded from the sampling. It's just villages. But most households are doing other stuff too. They have some small businesses. They're working for wages. Average educational attainment is pretty standard for middle-aged people in Kenya at that point in time. It's gone up a lot in recent cohorts, as people may know. So, much higher levels of schooling among younger people. And the key period when cash was going out is actually an interesting period. It was a pretty stable period. It was pre-pandemic. It was in between national elections, which tend to be kind of destabilizing. There was steady economic growth. So just keep that in mind as kind of background for the study period. This is a map that zooms in on the study area. The gray shaded sublocations and the white sublocations. The gray shaded ones are the high saturation sublocations where 2/3 of villages were treated. The white ones are low saturation, 1/3 of villages are treated. And then you can see the treatment and control villages in there. The southern part of the district, there's more areas where we weren't working. We're working in the 3 sub-counties, kind of more in the center and the north. We also surveyed markets, which you can see here on the map, those blue stars monthly. And, there's a couple things to keep in mind. There's just in terms of the proximity of villages, these aren't like super isolated villages. Within 2 kilometers of a typical village, there's 8 other villages. So something to keep in mind. There's, kind of a local area of activity there. Most people walk to the nearest market based on our survey data. They walk, on average about 30 minutes to a local market. Very few people at the start of the study in particular had motorized transport. I think it was 9% of the sample had a motorcycle, 1% had a car or something like that. So people really walking or biking to nearby markets to go shopping. And just a lot of economic activity was very localized. When we ask businesses, the vast majority of their customers come from the same village or neighboring villages. So that's the setting. Okay, so let me go through some of the results now that, that's background on the design. The first study published out of the Kenya General Equilibrium Study is the Egger et al. We collected data collection in the initial follow-up up to 30 months after cash went out, but the average was about 1.5 years after cash went out. This data is, available on the journal website. We welcome people to use it. A lot of people already are, just because there's many other uses for this data beyond looking at the experiment. We have baseline data and end-line data, so we have a panel of thousands of households, thousands of firms. We have repeated censuses, price data. So hopefully there will be a lot of additional uses. During the pandemic, we were able to use this data. We augmented it with supplemental phone surveys to try to understand what was going on with living standards, just using the panel aspect of the data. So I think there's really a lot of uses, hopefully, even beyond the experiment. What we showed in the initial study, first off, is we really replicated or confirmed earlier work showing direct recipients of cash benefit in many ways. They consume more food, they purchase more durables, food security improved. So that was something that had already been well established in previous RCTs. But what was a little different about the study is we were able to look at spillover effects. So local business revenue goes up a lot. And in fact, the per capita spending of households in our data lines up very closely with the per capita revenue gain of local businesses, since most shopping is very local. So business revenue goes up, their wage bill goes up, labor earnings of non-recipient households go up, as does their consumption. So we're able to kind of trace through impacts on the local economy. And at the same time, we were measuring inflation and found some inflation, but pretty minimal inflation of less than 1% on average. So that was really one of the key findings. Putting it all together, and because we were able to measure local GDP, we were able to estimate a multiplier of these transfers, the local transfer multiplier, and the real transfer multiplier was 2.5. So for every $1 of cash that went out over the next roughly 1.5 years, there were $2.50 of additional economic activity. $1 was that cash being spent, let's say, and the rest was additional economic activity. In macro models, one of the key parameters driving the multiplier is the marginal propensity to consume, which we find was very high in this sample. The eligible households that got cash spent the vast majority of it within the first year to year and a half after getting it. Not surprisingly, given these are poor households in rural East Africa. Okay, so the kind of summary figure from the first paper is here. We were able to measure the multiplier in a couple different ways. We had a consumption measure in yellow. We have an income-based measure in blue, so using different variables in the enterprise and household surveys. And then quarter by quarter in the bottom panel, you can see what the excess consumption was in areas that got more cash. And then on the right-hand side, the excess income in the areas that got more cash. How much did income go up? We integrate that up in the top panel. And with both measures, the multiplier is about 2.5. So again, with different measures coming out to be very similar. This is a bit larger than the kinds of fiscal multipliers you see in richer countries. But again, given the high marginal propensity to consume and other structural factors in an East African setting, maybe not surprising the multiplier would be a bit larger in this setting. All right, so this is the kind of punchline from the first paper. Excuse me. But that it was years of work, very exciting to work on, but it raised a lot of other questions like, what's generating the multiplier? What are the mechanisms underlying this? How are businesses able to expand production without causing inflation in this sort of area immediately? I think that was the kind of question that kept coming up. And we're able to work with a great group of co-authors. Some of whom are in the room. I see Tilman here and others to make progress on this issue and bring a clear theoretical perspective to the problem. Again, there's many factors that could contribute to multipliers. The Farhi and Werner macro handbook chapter lays them out really clearly. Again, in areas with high marginal propensity to consume, we'd expect a greater multiplier. Incomplete markets, nominal rigidities, other things can contribute. What we were really interested in was a very old issue in development, kind of related to some of the old work by Arthur Lewis and others decades ago about underutilized capacity, underutilized labor, underutilized capital. Through the years, there's been a number of authors that have documented that there's underutilization of capital and labor in low and middle income countries, but it hasn't become as much of a mainstream fact, at least in contemporary development economics. We didn't talk about it. We don't talk about it too much, but it's a very plausible contributor to what we find in this sort of East African setting we work in. The first thing we document is in our rural sample, 90% of firms are single employee firms. Not surprising to anybody who does field work in rural areas in low and middle income settings. But that makes the issue of kind of labor and divisibilities particularly salient. We went as part of this project and collected additional surveys, both in rural Kenya and also in Nairobi, to try to measure underutilized capacity or slack. And found substantial amounts of it, much more than you would document, say, in the US or rich economies. And we did this in a couple different ways. We did it with various survey questions. We did it with direct observation of how much workers were, sitting and waiting for customers versus actually, doing something productive in the shop. And, an example that we find is useful is the most common type of manufacturing in rural East Africa, which is a grain mill. Grain mills are ubiquitous. Every village really has one. It's hard for me to take my grain outside of my village because roads are bad, transport is costly. And grain mills often have a big milling machine and someone sitting there working them, but they have on average 1.9 customers per hour. So, the majority of the time, the grain mill employee is sitting waiting for customers. They have this big machine, they're staffed, but they're not necessarily actively working for much of the day. So if there is a local aggregate demand shock and people are buying more grain to get milled locally, they could pretty easily expand milling production here. So that's the idea. Similar stories in retail, similar stories in other forms of on-demand manufacturing as well, potentially. Okay, so the theoretical model, I think, is one of the main contributions of the paper, which is laying out how in a two-sector spatial general equilibrium model, you could get effects like the ones that we document, but what we change is this issue of indivisibility. It could be labor indivisibility, it could be capital indivisibility, but for some reason, it's not possible to say continuously vary labor. It kind of makes sense in a rural Kenyan market. I need someone to staff the store, so when customers come in, they're there to sell or to mill grain. So imagine that I need to have someone staffing that establishment. And, on the left-hand panel on the y-axis, that's the sort of labor choice of an establishment. Imagine that, production is expanding as we move to the right in that left-hand panel. If I'm kind of stuck with one employee, over time, my utilization of that employee will rise. That's in the right-hand panel, up to some point where they're fully utilized. Now everybody's bringing in their grain. I'm like working the mill, all the time. And at some point, I may need to raise prices to, basically ration demand. But at some point, I'll have enough demand that I can hire a second worker. I can buy a second milling machine. And there again, utilization would fall. If production increases further, utilization would rise. So you can kind of see this kind of jagged tooth edge, pattern as you expand. The immediate implication is these very small firms, these one employee firms, on average would have much more slack than larger firms. And we find that in our data. So, because we went and measured slack in representative samples of firms in rural Kenya and also in Nairobi, we find in our data the small firms have more slack on average than larger firms. We find that rural firms and in isolated markets in particular have more slack than urban firms. So the comparative statics that the model predicts come through in the data pretty closely. The last thing that we do in the paper, there's a few other elements, is again, we had written a pre-analysis plan where we were, where we used the experimental data from Egger et al. To see how far we can get with this particular labor and divisibility story. How far does the model take us in a two-sector spatial general equilibrium model that really mimics the data in the study? And it turns out just that one friction can generate a multiplier of about 1.6, a real multiplier of 1.6. So it actually goes quite a bit of the way towards explaining why there could be multipliers. Of course, as Farhi and Werner showed, there's many other factors that could be contributing to multipliers in this setting, other frictions, et cetera. So this isn't the complete story, but it's plausibly a very important part of the story explaining why the multiplier was as large as it was. Of course, the value of structural work is we can do counterfactual simulations, and you see that here, if you go along the x-axis here, what would happen if more cash were distributed? Not just the 15% of local GDP in Egger et al., but maybe 40% or 50%. We can simulate what would happen to the multiplier. And you see something pretty interesting here. The real multiplier actually falls and inflation increases. At some point, if you flood an area with cash, there will be inflation in this model. I think that kind of conforms with everybody's intuition. In this case, because more and more firms are going to be hitting that capacity constraint, and they're going to be raising prices. But with a smaller, I'm taking questions at the end, Sebastian. Okay, so with a smaller shock, you wouldn't have that kind of inflation. The other thing I want to mention about the structural work here is, one of the critiques of the first paper, and I think a good critique, is could there have been effects that we missed that were area-wide effects in Siaya County? What we're doing in the estimation is comparing areas that got a lot of cash with a little cash. But might there have been output effects or inflation effects that were ambient effects, what macro people would call the missing intercept problem? It's a fundamental issue with a lot of difference in different style designs or spatial estimation. The model allows us to estimate what those missing intercepts would be. And I think that's extremely valuable. So for instance, there is an ambient output effect that we miss. The true multiplier is actually probably larger than what we estimate, but there's also more ambient inflation than we thought, by about 1% more. So it wasn't huge, but instead of there being less than 1% inflation in total in the area, there was probably between 1 and 2% inflation in the area. So again, I think it shows the value of combining experimental work with applied theory to make progress on things that, where the econometrics can only take us so far. All right, so those are the first, two studies. Let me talk about the next two. The next study really is the paper that focuses on heterogeneous treatment effects and optimal targeting of cash transfers. This is the Haushofer et al. Was recently published. Targeting is a huge issue when we talk about cash transfers. It's a huge issue in development programming. In general, there are many people in this room have developed innovative ways of improving targeting through ordeal mechanisms, new data sources, et cetera. It's an issue of general interest, and the kind of near universal focus of a lot of programming and development has been to focus on the poor, the poorest of the poor. How can we identify the poorest as a goal? Makes a lot of sense. We care about poverty. Intuitively, it makes sense to target programs to the poor. We stepped back in this study in the context of cash transfers and said, well, let's think a little more broadly about the social welfare function. As others have done in this literature, others have done related exercises, but we really wanted to elevate this question a bit more and think about what would be optimal in the case of cash. So what I've written down here is a pretty basic social welfare function across households H. The social value or social welfare that's accrued from a particular household having an outcome Y sub H is determined by the function W. This is a social welfare function. You can imagine an increasing concave function probably. We probably care about, gains among the poor a lot, and as people get richer, maybe a bit less. But their outcome Y, which could be consumption, it could be income, could be assets, is determined by their treatment status, T sub H. Okay, so I think that's pretty standard. What we do though is break down that T sub H into its two components. Your T sub H is your Y naught, what your outcome would be in the absence of the intervention, plus the gain delta you would get if you got the intervention. All right, so that's just kind of writing out, potential outcomes sort of notation, very, very standard. But once you write it down in this way, it really highlights a potential tension. Could it be the case that there's some trade-off between targeting the Y naughts and targeting the high deltas here? So, in a simple case where everybody experienced the same delta and we had a concave W, we would want to target the lowest Y naughts. They'd be giving us the largest social welfare gain. In a case where the deltas were the largest among the poorest, we would definitely want to target the people with the lowest Y naughts, the people with the poorest folks. They'd gain the most and we'd get the greatest gain from targeting the poor. But if there were a case where the poorest didn't have the largest delta, better off people had larger gains from the program, there could be a trade-off here. And that was really the case we were interested in. So, we wanted to estimate empirically, was there this trade-off? Is this even an issue or not? And we did this using machine learning methods. And again, these are methods that have spread in economics in the last decade. Many people have been using them. We decided to use an ML approach developed by Athey and Wagner, the generalized random forest approach, which is really very well suited to understanding and estimating heterogeneity, to estimating conditional average treatment effects. It's kind of developed to do that. It also works well with relatively small samples in this case. So we used this approach to estimate both Y naught and delta in our sample. And the great thing about having a large sample is we're better powered to understand this heterogeneity. So we have, in total about 9,000 or 10,000 households that we surveyed as part of the KGES study. So that, that's the first piece. We just have the second piece that's very important is we have experimental variation. So we actually know what average treatment effects look like in particular subgroups. So we can estimate what effects would be. We can verify them with experimental data. And it turns out that this GRF approach works much better than the typical kinds of OLS models people would use that aren't regularized. There's just naturally going to be overfitting in OLS. And they actually do better even than lasso models because GRF is just well adapted to this problem of estimating conditional average treatment effects. So what do we find? This is a plot of the relationship between the Y naught variable, so my outcome without treatment, and delta. Remember, if this is flat, or if this is downward sloping, it's a no-brainer to target the poorest households, but it's upward sloping. The correlation is 0.4. Here we find similar relationships with assets and income. They're positively correlated here, suggesting that there is a trade-off. It isn't just an obvious thing that we should always be targeting the poorest of the poor under this social welfare function. Now, we had laid out in our pre-analysis plan some standard social welfare functions that could be used here. And we carry out that analysis in this paper that was recently published. And what we basically find across a range of social welfare functions, a range of reasonable parameters is it would take a social planner who has just had extremely redistributive preferences to only want to target the poorest of the poor. So they'd have to have a social welfare function in either a CARA or CRA kind of formulation in which they valued the utility of someone with half the consumption of another 360 times more to only want to target the most deprived. Now, obviously, the more curvature you have in the social welfare function, the more you're going to tilt towards targeting the more deprived. But just generally that corner solution is only going to be optimal under pretty extreme circumstances. So again, we found that to be an important insight. Stepping back, this doesn't mean that just because, for cash, this holds for cash, it would necessarily hold for other interventions. We'd want to do similar analyses for other outcomes, for other interventions, for other outcomes to better understand how general this finding is. And this is one setting in rural East Africa. Okay, so we're not saying we shouldn't ever target the poorest of the poor, but in this setting, it doesn't seem to be optimal. You could think of different approaches. Maybe cash is targeted often to those with greatest impact, but other interventions are targeted to more disadvantaged groups. The other thing that's actually important in this setting is in the rural East African communities we work in, the baseline variation in income is relatively muted. Almost everybody, for instance, is a landowner in this area. They have their own land they're farming. In many poor parts of rural South Asia, that's definitely not the case. There are landowners, there's landless, and the differences in wealth could be really big and in income. Remember, I showed you that the eligibles and ineligibles differed by a factor of 2 in wealth. Factor of 2 actually isn't that big compared to what you might observe in other settings. Okay, so we don't want to oversell that this is a universal finding, but in this setting, it wasn't optimal to only target the poorest of the poor. And again, because we have a large sample and we can estimate heterogeneity with some power, we're able to say something about this issue. I'll mention one last thing, because this is something that people could incorporate into their data collection, I think, fairly easily. We randomized the order of data collection across villages, and we also work with GiveDirectly to randomize the order in which cash transfers went out. And actually, when we started, we said, oh yeah, that's cool, let's do that. It turned out to be really essential for a lot of these papers that we can measure effects reliably at different points in time because we have representative samples every quarter. Remember, I showed you that figure with the multiplier. Well, we have like representative slices in every quarter. We're able to look at the effects on consumption over time in a representative way because we randomized the order of data collection. So to the extent that you can do it, it could be useful. Okay, let me talk about the fourth paper, which is the new one. And again, my co-author, Michael Walker, will be presenting later in the week. Here, this is impacts on child mortality. I've long been interested in health, my co-authors as well. So we wanted to understand this question. Again, a little bit of background. Kenya, for East African standards, actually has pretty good healthcare access and infrastructure compared to some neighboring countries that are poor. So even though delivery, getting access to good delivery services can be expensive, and sometimes it can cost over $100. I think the 90th percentile cost was like $200-something in our day. So it's pretty expensive to sometimes access hospital delivery in a place with a doctor. Facilities are there. They're not always super far away. And that's not the case for some other rural African settings. So, that's the setting. Very basic deliveries in local clinics or dispensaries could be much cheaper, but you wouldn't have access to as trained medical professionals or equipment. So what we did a couple of years ago is we did another census of all the households in this area, our kind of third follow-up census, but we added in a new module collecting data on birth outcomes and child survival. And we followed, standard survey modules. On this, we did well in getting, over 90% of the sample. Again, and what's unusual about the samples, because we're working in an area with 65,000 households and we collected births for around a decade, we have 100,000 births in the sample. Other people who have studied unconditional cash transfers have been interested in this issue of child survival, but if you have a small RCT, you're just not going to be powered to detect effects. So again, the scale of data collection enables us to look at things differently than some earlier work and just gives us better powered analysis. There had been some really nice observational analysis looking across countries that had rolled out cash that had found some evidence of child survival gains. But again, with those observational studies, there's going to be questions about the timing of those programs and why they were rolled out in certain places and not in others. So experimental variation can be useful to bring to bear here. We pre-registered our primary outcomes, the classic ones: infant mortality, child mortality. We had several secondary outcomes, including behavioral change. Did you access more services? Which I'll come back to. We follow the methods in Egger et al. There are really two main models that we run in Egger et al. And in this paper. The first one is reduced form. We take advantage of the village level randomization and the sublocation saturation randomization. And we basically have two terms for, what's the effect of being in a treatment village and what's the effect of being in a high saturation sublocation. And I'll show you some of those estimates. Then we have a second specification that uses all the variation in local transfer exposure nearby, including all the idiosyncratic variation in the placement of villages, being maybe located near a sublocation with a different treatment status, et cetera. So that's probably the preferable estimate and gives us, in some cases, more precise estimates. In general, both in Egger et al. And in this study, we use a procedure to try to figure out how large the radius of spillovers is. And we basically go out to the radius that gives us signal, like, using a Bayesian information criterion approach. And typically the radius is only 2 kilometers, sometimes 4 kilometers. It's very localized. As I mentioned before, the kind of focus of economic activity is often very local, my local market, villages around me. So maybe it's not surprising that it's really the local radius where we see effects. So this is the kind of regression specification. Y here would be an outcome for, say, child mortality or infant mortality. And the amounts of cash going into my village and in the local radii are represented by the amount variables there. And those are instrumented with the experimental design. Like, what was the intended amount of cash going into these different radii? The implementation of the experimental design was really close to plan. So the F statistics are very large. They're typically over 100. And so actually it doesn't even matter too much if you IV or not. And then we also condition on the share of eligibles in different radii and various fixed effects. Results are robust to different types of clustering. We do multiple testing adjustments here as well. Okay, so what do we find? Let me just show you kind of some of the visual results. So what we have here is we've divided the data into 3 time periods: the pre-cash transfer period, 2011 to 2014, the cash transfer period, 2015 to 2017. This was the period when the large $1,000 cash transfers were going out, and then the post-cash transfer period. This is the mean, the red line here, in the control villages in the low saturation areas here. And these are the eligible households. These are the poor households in those areas. And you can see there's roughly 40 deaths per 1,000 over time, pretty stable over time. In the broader trend is declining, but actually, like, part of the reason in this latter period it isn't declining is there was COVID, and there's this like big spike in infant mortality and child mortality in that period. But it's pretty stable at 40. Of course, in a country like the US, it's just an order of magnitude lower than that. And then this is the infant mortality in blue among eligible households in treated villages, high saturation sublocations. Okay, so the kind of biggest contrast in the kind of experimental design. You can see at baseline, we can't distinguish that they have the same infant mortality. Those gray whiskers are the kind of confidence interval on the difference between the two. They're pretty similar. And then there's this big drop by about half in infant mortality when the cash is going out. Once the cash ends, they converge again back to about 40. But for those few years, there's a huge reduction in infant mortality. That difference is significant at 99% confidence. It's a huge effect. And this is really the main result of the paper. And I'll show you a few other things to back up where it's coming from and what's going on. But this is just kind of like the rawest data. Other things people may be interested in is the yellow here are the ineligibles. These are the richer households. They have about an infant mortality of 30 per 1,000, pretty constant throughout the period. So if you compare the yellow and the red here, you see that gap. Maybe it moves around a little bit, but the households that are about twice as rich or have 10 or 20% more consumption have considerably lower infant mortality. So like even in the cross-section observationally, there's the same pattern. If you're better off, you're richer, you have less infant mortality. Okay. This is a table of regression results, and we have both the reduced form specification and the spatial IV. And then we have infant mortality, meaning under 1, and child mortality, meaning under 5. We have the effect in own village and the spillovers, and then finally in the red box is the sum of the two, the overall effect of cash going in. Maybe our favorite specification is column 4. It's under 5 mortality. It's using all the variation in cash going in. You can see there's actually treatment effects both from own village and the spillovers of kind of similar magnitude. And they add up to this large reduction of 25 deaths per 1,000 on a base of 57 deaths. Those are under 5 deaths, so a bit more than the 40 I mentioned before. So that's a reduction of 45% in child mortality. T of 3, and even with the multiple testing adjustment across various specifications, significant at 95%. So that's, again, the kind of central result of the paper. So now, if we look at the total number of deaths and we add them up, it turns out that this cash transfer just in this one area among eligible households reduced the number of deaths by about 90. That's our best statistical estimate. 90 lives were saved. If you put a value on each of those lives and you look at cost effectiveness, this turns out to be like a fairly cost-effective way to save child lives, even though it wasn't even the original goal of the program. So we have a section of the paper just comparing it to other direct health interventions. It becomes, a question of how much value you put on lives saved, as it often is in these kind of health economics activities with DALYs and value of statistical life. Those things are going to matter for like what that means. Okay, so what happened? Where does this result come from? I'm going to show you three patterns that shed some light on what happened. We collected verbal autopsy data, so we know the cause of death. At least we can predict it, and it's been validated in Kenya, so we're pretty confident about it. About 2/3, the total reduction. Now I'm going back to infant mortality again. It was a drop of 19 deaths. About 2/3 of those are from neonatal delivery causes, birth complications, etc. That's really where the gains come from, and you can see that on the left-hand side. There's some reductions in other categories as well, but that's really where the bulk of lives saved is coming from. Fewer birth complications, fewer deaths around delivery. This is another figure, and again, maybe a little bit hard to read, so let me walk you through it. What we have here on the x-axis is the timing of when you were getting cash. On the left, you were getting cash pre-pregnancy or in utero. In the middle are the people who were getting cash, like literally actively in one of those three tranches in the month of delivery. And then on the right, you were getting cash in the infant period or in the sort of 1 to 5 year old period. So we have all this variation because people were getting pregnant over time and cash was being distributed randomly. So we have this variation. The other thing I'll mention is because there's this 8 to 10 month set of tranches, some people are in multiple categories. So if I'm in the birth month category, I probably also have a bit of time in the infant category, and I might be counted in different groups. But what we're doing here is running separate regressions if you were at all in the in utero category, at all in the birth month category, just for simplicity. And there's a very clear pattern. Getting cash before the birth month is good. It seems to reduce infant mortality, but there's a much bigger effect from getting cash when you're literally delivering in that month, which again is consistent with this notion that having good delivery services could be important in reducing birth-related complications. And that's just a huge effect. I mean, that effect would kind of reduce infant mortality down to US levels here. And of course, there's a standard error on it, but really big effect. Getting cash when the kid's like 1 or 2 isn't really affecting their survival much. Of course, there isn't really much mortality for 2 or 3 year olds. Most of the mortality is like the first month, the first 2 months, and then it falls dramatically. So but again, the blue box here is a very striking result. Where is it coming from? We asked about, and we actually pre-specified various behaviors to see if they changed when people got cash. Were they actually accessing more services? And they are. There's a big increase in access to hospital deliveries. And hospitals typically have doctors and better quality delivery services. So the base rate is 39% in the control group is delivering in a hospital, and that goes up by about 25 percentage points in the treatment group. So there's a 70% increase in use of hospital delivery services. Maybe a bit of a hint on antenatal visits as well, but not so much on other things. If anything, there's somewhat fewer C-sections, but again, if I'm getting access to a doctor and better services, maybe I never get to the point where I need to go into a crash C-section to begin with. At least that's our interpretation for now. All right, so that's the fourth paper. I've got about 5 or 6 minutes left. Let me just give a little bit of a summary, and I'm really excited to open it up to questions. So 4 kind of bullets for the 4 papers. The first thing we found is evidence of meaningful spillovers in the Egger et al. Paper with only modest price inflation. I think for us, the takeaway here is some of the concerns that big infusions of cash transfers would lead to runaway inflation, at least at the magnitudes of cash that we studied, weren't borne out here, and there were definitely big spillovers and multipliers. The second study tries to understand these results and makes the case that labor indivisibilities or, equivalently capital indivisibilities could be a key reason behind the multipliers that we estimate, that underutilized capacity and slack is a key part of the story, as our survey evidence has confirmed. There's just a lot of slack in these enterprises in rural Kenya. At the same time, the structural modeling shed light on the fact that maybe there was a bit more inflation than we thought initially. Not runaway inflation, but a bit more than we thought. And the simulations indicate that if you really ramped up the cash, you might have to start being concerned about that nominal versus real difference. The third finding is, despite our kind of immediate inclination to always target everything to the poorest of the poor, at least in our East African setting, it didn't appear to be optimal with cash transfers. That distributing cash to folks based on a balance of deprivation and impact could be socially optimal under the social welfare functions most of us would think are reasonable here. And I think it's still an open question about what applies to other interventions, as I alluded to. And then finally, the kind of new result, unconditional cash transfers in this setting have a large effect on infant and child mortality, really big reductions of between 40 to 50%. And a key behavioral change that seems to be driving it is different healthcare usage. When they have money in hand, people are much more likely to use a hospital. Maybe they can afford the transport more. We've heard anecdotally, some people don't want to use an ambulance or get transport to a hospital because they're afraid they won't be able to afford the transport back. So, people are thinking about this in sophisticated ways, and they're concerned about transport. They're concerned about being able to spend that $100 or $200. But if they're actively getting cash, they have that money on hand and they do it, and their children have better birth outcomes. There's a bit of a question like, why aren't people saving? I showed you if you got the cash a year ago, there isn't much in the way of benefits. Why don't they save that $100 or $200? I think that's still a bit of an open question for us. We do know the marginal propensity to consume is very high, and there's a lot of competing pressures, on that money. But I think it's still a little bit of an open question why there isn't a little bit more saving of that $100 or $200 that you may need for delivery services. All right, so just to wrap up, I think one of the central themes of the research is there are benefits that we might not have thought existed when we started working on this project. There are benefits beyond the direct recipient's short-run consumption gains here. There's spillovers on local enterprises and households. There are these benefits on the next generation in terms of child health. So if we ignore those, we may really be understating what cash transfers do. And when we compare them and their impact to other interventions, we may be kind of underselling them. Our ongoing work is estimating longer run effects on household outcomes. We're trying to estimate, 10-year multipliers to see how much persistence there is, whether there's lingering effects on market structure, migration, et cetera. So, we just finished, as I mentioned, the kind of 10-year follow-up survey, and that's kind of the next step for us. And we're very interested in human capital outcomes for the next generation as well. So there's a bunch of open questions that we hope to continue making progress on with 10-year follow-ups and hopefully beyond as well. And as I alluded to up top, the results are already having some influence on policy. Kate Orkin, again, whose paper with Paul and Rob was presented yesterday. It's a great paper with a lot of commonality with our work here. Kate has been advising the government of South Africa on social protection programs. And during COVID, they launched an expansion of cash transfer programs, which actually has continued after COVID. It was an unemployment insurance program called the Social Relief of Distress Grant. And according to the policy documents Kate has shared, and according to her own experience with conversations with Treasury and others, the fact that cash transfers had been documented in another African setting to generate local multipliers and local spillovers for local businesses was actually critical in enabling this program to be expanded and extended over time. So it's a pretty exciting thing to be part of. And I think for all of us in this room, I didn't even know about this until a few weeks ago. We've been working on this project for years to think about all the uses of our data, of our evidence in development economics that we may not even know of, how they're being used by governments and NGOs. So it's very exciting to be part of that. And we're really thankful that the government of South Africa was looking at the scientific evidence when they were designing policy. I also know the evidence is being used by other governments, donors, GiveWell and others. There's some large-scale rollouts of unconditional cash transfers that are going on in various countries, including Malawi. And the hope is that donors will continue to look at the evidence base. It's been such a difficult, challenging moment for development economics policy, evidence, with so many programs that showed positive impacts being terminated, being canceled, especially with the shuttering of USAID. But things will change. Evidence will still be used. It's more important than ever. And I think all of us in this room should be proud of what we're doing to expand the evidence base to inform policy like this policy in South Africa. Thank you.